Thank you, John, for having me. And it's very moving for me to see just a growing number of people really committed to this issue that's very near and dear to my heart. I'm a mother who is living with hepatitis B, and I see it as nothing less than an urgent crisis that we currently have 6.4 million children under the age of 5 living with hepatitis B in this day and age with all the tools we have. I did not pass on hepatitis B to my own children because I was able to get testing and care, and my children received the recommended hepatitis B vaccines that are so effective at preventing transmission. But I am so grieved by the many that are not so fortunate and by the devastating impact that Hep B has on mothers, children, and families globally. I found out I had hepatitis B when I donated blood in college. It was alarming to me, and I wondered what it would mean for my future. I count myself very lucky that I continued my studies to be a physician without any issues. I did not face the stigma and discrimination which have kept so many people with Hep B pursuing careers that they want. When I met my husband, he was supportive and he got vaccinated to be protected. I'm grateful also that I did not face the rejection and abandonment that so many women experience from significant others and their family members because they have hepatitis B. When we got pregnant, the idea that I could transmit this virus to my babies during childbirth concerned me tremendously. But my viral load and my liver tests were monitored closely during my pregnancies, and I did not need antivirals, but they were available had I needed them. I delivered at hospitals that gave the Hep B birth dose within 12 hours, and I'm so relieved that our 4 children are free of infection and will have a hepatitis B-free future. But I'm gravely concerned that this is not accessible to everyone, and millions of mothers cannot say the same. I hear stories from mothers around the world unable to access testing, life-saving vaccines, or treatment, and they must live with the guilt of passing on a lifelong infection to their children. There's not only the mental health impact and the immense worry, but also the ongoing care that they must find for their children, helping them navigate the life where they may face stigma and discrimination, limited opportunities because of their infection, and the risk of dying young from liver cancer. Transmission takes a toll, not just on the child, but also on their family and their own future. The burden of this disease casts a long shadow on these children's lives, their life opportunities, their communities, and generations to come. These consequences are even more travesty when you think about Hep B birth dose being available for decades now and how affordable it is. It is one of the most effective and affordable weapons we have in our fight against viral hepatitis. We should be ashamed that only 43% of infants are receiving birth dose, and that we've decided that these children's lives are not worth spending 20 cents on. It is time for us to do everything to end the cycle. We need political will, followed by resource commitment. We need prioritization of Hep B that matches its global burden of disease. We need removal of barriers, and we need true community involvement. We must not wait any longer to end mother-to-child transmission of hepatitis B. Mothers and babies can't wait.